Assalamu alaikum and Ramadan Mubarak. Hello and welcome to the final episode of the Health Show Ramadan Special here on the Islam channel. Now, throughout Ramadan, we've been discussing various topics relating to health issues such as healthy eating, weight loss and different diet systems. On last week's episode, we talked about irritable bowel syndrome, or IBS, as it's more commonly referred to, which I'm sure was very helpful to you at home. Now, on today's show, we'll be discussing an illness that some of you may have fallen victim to. Peptic ulcers. Yes, that's right, that awful illness which gnaws away at your stomach. So what actually causes a peptic ulcer? And more importantly, what can we do to help prevent it occurring? Now, with us in the studio again today is our resident expert, Dr. Ibrahim Adwan, a consultant in alternative medicine. Now, Dr. Adwan will be guiding us through the many causes and treatments of peptic ulcers, all with Ramadan in mind. You'll also get a chance to have your questions answered by Dr. Adwan by calling in live or sending an email. Lines will be open later on in the show, so hold on until then. And talking of emailing, you can email us at healthshow@islamchannel.tv. Now, we must stress that should you suffer from any medical problems, it is always highly recommended that you contact your doctor or medical expert first. Now, if you've ever had a peptic ulcer before, you'll know exactly how painful it can be. But are there specific factors which actually lead to a peptic ulcer? Well, Dr. Adwan, first of all, let's talk about the whole concept of peptic ulcers, because we hear the term ulcer, and it seems to have lots of different names. So what distinguishes, say, a peptic ulcer compared to any other kind of ulcer that we hear about?
When we say peptic ulcers include stomach ulcer, as it is, and the duodenal ulcer. Duodenal ulcer, duodenum. Duodenum is the first part of the small intestine. So this is both of them, stomach ulcer and duodenal ulcer, called peptic ulcer. So what's the definition for that? Definition of ulcer is sore in the inner layer of the stomach or the duodenum. Inside the inner layer of the stomach or duodenum, there is what's called mucous membrane. So there is sore in that ulcer in this part of the ulcer, not the main wall of the ulcer, no, the stomach, the mucous membrane.
And we'll get to the specifics a little bit later on in the show, where we're going to guide people through the exact definition, the causes, the symptoms, and so on. But looking at the whole general concept of ulcers, we hear about it a lot, and people often just go for the, something that they find in one of the pharmacies or something like that. But how easy is it actually to avoid in the first place?
To avoid the ulcer, we have to look the causes of the ulcer and how to avoid it. The main cause of the ulcer is the Helicobacter pylori, sort of bacteria, start to affect the inner layer of the ulcer. Is the stomach is the mucous membrane. This is the main cause, but they have precipitating factor for that. Stress, one of the main causes.
And we hear about that a lot, don't we?
Yeah.
Well, we'll talk about that quite a bit more in a while. So just what are we doing to our bodies that lets us go through such awful pain? Well, we went to meet an expert on peptic ulcers to find out more.
So a peptic ulcer is a break in the lining of the esophagus or the stomach or the duodenum, the first part of the small bowel. If you imagine, it's a little bit like a mouth ulcer that patients or people may often have had in their lives, but a peptic ulcer is significantly larger than that. The most common cause of a peptic ulcer is an infection, a bacteria called Helicobacter pylori, and this is usually acquired in childhood. As opposed to most other infections of the stomach, it's not something that causes an illness or symptoms when a patient first acquires it. So most people don't know that they have it. It stays for many years and can cause complications such as peptic ulceration, usually many, many years later. Probably the most common symptom is of an upper abdominal pain, a persistent gnawing type of pain, which sometimes goes through to the back. It can be made worse with eating that pain, occasionally actually made better, depending on where the location of the ulcer is. There are quite a few other common associated symptoms, such as perhaps a nausea or occasionally persistent vomiting or belching. And sometimes an ulcer may actually cause bleeding internally, and so the symptoms that a patient could have could relate to that, such as anemia, and very occasionally actually vomiting up blood or passing blood in their stool. Peptic ulcers are an imminently treatable condition. Usually it's a case of giving medications for about 4 to 6 weeks, which are safe and very well tolerated. And the medication is to reduce the acidity in the stomach to allow an ulcer to heal, and also a separate medication, antibiotics, to treat an infection if Helicobacter is the cause. Some patients will probably find, if they have a peptic ulcer, that certain foods, particularly spicy foods or other heavy foods, can exacerbate their symptoms. Some patients may actually find that certain foods, such as creamy, milky types of foods, actually make their symptoms better. But this is, of course, not the treatment of an ulcer. I think it would really depend on the severity and how frequently they have symptoms. I think if a patient had mild symptoms of indigestion or occasional symptoms, then continued fasting is probably safe. If a patient has constant symptoms or worsening symptoms, particularly worrying symptoms such as anemia or passing or vomiting out blood, then I would recommend not fasting and seeking urgent medical attention. 2 things I would probably say. I think firstly, it's quite common for people to have occasional indigestion or heartburn type symptoms, and that's probably normal. But if the symptoms are persistent or they're worsening, then I would certainly not ignore them and make sure that you see a doctor about these symptoms. The second piece of advice I would have, if you've had an ulcer in the past in particular, then be careful with avoiding certain medications that can make an ulcer recur, particularly aspirin, which thins the blood, or certain types of painkillers, such as Nurofen or ibuprofen, can cause an ulcer to occur. So if you've had an ulcer in the past and the doctor is wishing to prescribe you one of these 2 types of medications, then do let that doctor know that you've had problems with ulcers before.
Well, some great advice there on what you should and shouldn't be doing to your stomach to avoid peptic ulcers occurring. And it seems to be all about being strict with yourself and following a plan. But I guess for most of us, that's a lot easier said than done, isn't it? And, you know, we've been talking throughout this series about Ramadan, and we heard there from our expert that obviously during Ramadan there's extra things to be aware of with peptic ulcers.
Mostly the other causes of peptic ulcer, in addition to the bacteria, Helicobacter pylori, stress, smoking, to alcohol. Alhamdulillah, we don't drink alcohol. Pickled salt, too much salty food. This is very bad for ulcer. Too much milk.
And how does that affect you if you've been, say, fasting all day and then you have one of these foods that might actually irritate an ulcer? Would that be heightened or lessened because you've been fasting?
The problem, because the stomach ulcer and the duodenal ulcer is a little bit difference between them. The stomach ulcer feel good when they eat, while the peptic ulcer feel good when they fast. So it depends actually, or the opposite. But that's why I recommend when it comes to break your fast, just 1 date and 1 or 2 glasses of water, soup, salads. We need green. We need a lot of green.
And it's funny, you've been saying this throughout the entire series. Yeah. When you do break your fast, do it very, very gently. Well, let's just start at the beginning here. We've got the definition here of exactly what a peptic ulcer is.
Yeah, here it is sore in the inner layer of the stomach or the duodenum, which is the mucous membrane. You start here the bacteria to dig in the mucous membrane and make like little hole in it. And this is exactly the ulcer as we see in the picture here.
So now let's move on from the definition to the actual causes. We heard a little bit there from our expert about how it actually starts, but maybe you could talk. Well, actually, we've first of all got the types here, so let's talk about them first.
So this is the peptic ulcer, including two things: the stomach ulcer itself and the body of the stomach, or the duodenal ulcer. Duodenum is the first part of the small intestine, and the difference between them, the stomach ulcer come to older people, more above 50, while the duodenal ulcer come between 25 to less than 50.
And why is age an issue here?
Because the duodenal ulcer come to sensitive people, use their mind too much. The duodenal ulcer come to the older people where they lose the protective layer of the stomach, which is the mucous membrane. It's very, very important, the mucous membrane. So when we age, we start to lose what we have atrophic gastritis. And this is start to affect our lining mucous membrane in the stomach.
And looking at the stress aspect, which we're going to talk about more in a while, does stress create more of an issue for this mucous membrane?
That's right, because stress is one of the main causes which is precipitating to the ulcer and give easy way to the Helicobacter pylori to dig in the mucous membrane. We know that about 70 to 80% of our immune system in the gut. So stress weaken the immune system and also weaken the digestion, because when you are under stress, your digestion is
Well, you talked there about stress, and we've got here all the different causes. And, of course, you know, stress is a big, big aspect of it, isn't it? We always seem to associate ulcers and stress as almost being part and parcel.
Especially the peptic one, as I said, more people are doing with like managers, like executives, those things affecting by stress more than the stomach ulcer.
And again, that's an age thing as well, isn't it? We're naturally at the executive age older as we get older.
Yeah, but the main cause, as we see here, is the bacteria, Helicobacter pylori. But there are other precipitating factors which leads for Helicobacter pylori to grow up more and more and to affect the integrity of the mucous membrane of the stomach and duodenum, like overuse of non-steroidal anti-inflammatory drugs like ibuprofen, Nurofen, and paracetamol.
Which we heard there on the VT.
Yeah.
What about, you know, our likelihood of getting ulcers? I mean, for example, is it something that's hereditary, that, you know, if your parents have them, you're more likely to get them, or is it far more about how you look after your body?
I think more than in your lifestyle and your rather than hereditary. I never heard that maybe if it's played, it's less than 1 or 2%. I never heard about that.
So it's mostly down to lifestyle?
Mainly it's lifestyle, what you eat, and how strong is your immune system. So it depends on what you eat and how much medication, because a lot of people taking a lot of medication, smokers, taking alcohol, food intolerance play also a part in it.
And talking of foods, we've got the nutrient deficiency. So I suppose, again, it's this thing which we've been talking about throughout the series, about eating healthily, eating good food, trying not to have too much processed food.
By the way, one of the causes also low hydrochloric acid. And as we age, our hydrochloric, because this is the main thing, hydrochloric acid, HCl in the stomach, help digest the protein foods, especially the animal protein, red meat and chicken and those ones, and also kills any sort of bacteria or fungus or parasites. So when it is low, so the bacteria find the way to start to dig and causing the ulcer. So why? What's the causes of, as we said, when we age, the HCl acid become low, lot of zinc, fasting, taking too much medication.
So as you say, basically, again, aging, as we get older, we've got to have to be more and more careful because we're more susceptible to doing it. So let's now talk about what it feels like when we get one, especially those early signs, so that you know you should be correcting your lifestyle. What are some of those very early indications?
Pain. Gnawing pain, cramping pain, spastic pain, especially between the rib cage and the umbilicus here. And this is sometimes it's severe, sometimes it comes after food, sometimes when you are, it depends on sort of the ulcer, whether duodenal or ulcer.
So what would be the difference between, say, just having, you know, a regular stomach ache, food poisoning, or an ulcer? How would you be able to distinguish them?
Sorry, you mean the pain?
Yeah, so if the pain that you get from an ulcer versus the pain you get from food poisoning or from, you know,
this
cramping.
is sometimes so severe, and sometimes with vomiting, with nausea, with bloating, with diarrhea, with it. Most of the time
So is it more of a piercing pain?
Yeah, very, very piercing pain. It's wake up the people from sleep. And real areas, so a lot of cases, very, very severe pain, yes.
So let's have a look, because we've got here alternative treatments, because a lot of us, we go to the pharmacies and we'll pick up a whole load of different kind of products which claim to be good for ulcers. And obviously, as we always say, go and see your doctor or medical practitioner first.
That's right.
But what about some of the alternative routes that one can take to maintain or prevent or try and deal with ulcers?
Of course, first of all, we have to stop, if somebody is a smoker, you have to stop smoking. We have to look what sort of food you're eating, because before we used to say because of the ulcer too much acid, and that's why they recommended milk for it. Now we say no, because of the ulcer Helicobacter pylori, and there's no place for milk here. So and milk also one of the other food might cause for some people food intolerance. So we have to be careful what we eat. Because, and especially in Ramadan, what food which causing you bloating, gases, headache, lack of energy, and sort of things, you have to avoid it. So look at what food you eat and try to avoid it. But my favorite for the ulcer is cabbage juice, one of the best really. Why cabbage juice? Cabbage juice is rich in amino acids called glutamine. Glutamine make like repair for the ulcer. And even some people take it as glutamine as supplement, powder or capsule. But they add on it also, very good thing is aloe vera, in addition to...
And we hear aloe vera being mentioned a lot. We've got a few more things here as well, different plants like plantain. Ginger, we hear a lot about ginger being good for stomach health.
Ginger kills more than 20 kinds of Helicobacter pylori and help nausea, help digestion, help because this is the only one we give it to, even to the pregnant woman, because of sickness, and kills the Helicobacter pylori.
And I see our favourite there that we've been talking about throughout the series again is making sure you have enough water.
That's the thing, because water dilutes if there's too much acid. And yeah, you're right. That's why I recommend when you break your fast one day, 1 or 2 glasses of water, soup, water. We need salad. We need a lot of greens for the ulcer.
Well, I hope if there's only one thing that people take from this entire series is that when we break our fast, you've mentioned it, I think, virtually every show, one date and some water. Good way to start.
1 or 2 glasses of water to start with, and soup. And we need, for hair especially, we need a lot of greens. And that's why I recommend cabbage juice. But because of cabbage juice, sometimes, because bloating for the people, I recommend to put ginger with it. Juice it with ginger.
To counteract that.
Yeah, juice with ginger. Put some carrots to give it taste. Some apple if you like, but carrot is good, better because it's beta-carotene. Beta-carotene change in the body. Vitamin A. Vitamin A try to help the mucous membrane, build the new mucous membrane. One of the benefits of vitamin A. And,
so if you had to conclude here about what people should be thinking about, what would be your golden rules about how to deal with and how to, more importantly, avoid a peptic ulcer?
Food intolerance, stress. I think this is the main thing to start with. Look what you eat. This is more important, because what you eat is affecting, you are what you eat. And this food intolerance is very important. Food intolerance, stress, try to relax as much as you can, especially in Ramadan now. And we need the greens, a lot of salads. We need antioxidants. This is to strengthen our immune system. That's why not everyone has Helicobacter pylori gets ulcer. Why is that? Because of depends on how strong the immune system. Immune system is strengthened by the antioxidant, vitamin E, vitamin A, beta-carotene. So we need those from the salads.
And the older we get, the more aware we have to be to look after ourselves.
That's right. You have to look after our food. Start with food first before you do anything.
Yeah.
And we need a lot of greens here. We need the salads. Juice, as I said, cabbage juice, one of the best thing for ulcer. Banana is good, whether plantain banana. This is plantain difference you mentioned here, and plantain banana, this is in tropical sort of banana, a lot of starch in it.
Well, I'm sure a lot of this is going to come up during our calls later on. But a very good overview there for people. And as we say, we're going to be talking a lot more about this later on. But right now, it's time for a short break. And when we do come back, Dr. Adwan will be answering your questions live on air. So we look forward to seeing you in just a couple of minutes. Bye for now. Welcome back to the Health Show Ramadan special. Today we're looking at peptic ulcers with Ramadan in mind. Now the lines are now open, so if you'd like to ask Dr. Adwan a question regarding peptic ulcers, do give us a call. The number is 0207 374 6423, and you can also email your questions at healthshow@islamchannel.tv. Now, Doctor, we've been talking a lot there about the natural ways we can deal with it. So again, just sum up some of the foods which actually seem to be good for general health, but are specifically good for people with ulcers.
My favorite is cabbage juice. Cabbage juice is rich in amino acids called glutamine. Glutamine helps to repair the ulcer, whether ulcer in the stomach or duodenum, even ulcerative colitis, Crohn's disease helps too. Ginger is very, very good, kills more than 20 kind of Helicobacter pylori, help digestion, help nausea.
We often hear about ginger, like people even take ginger for things like seasickness and
right.
morning sickness, all sorts of things. Ginger seems to be really good.
That's right. Also thermogenic, it helps to dilate the vessels, it helps people with high blood pressure too. Turmeric is also anti-inflammatory, is very, very good. Honey, pure honey, natural honey, seasonal one, and the local one. I prefer the local one.
And they always say local honey, and not so much this time of year, but in the spring, if you suffer from hay fever, you get a local honey.
Because of the flavonoid in the honey and the antioxidant in it. Yeah, that's hydrogen peroxide, you're right. And licorice is very, very good. Aloe vera.
Okay, fantastic.
Aloe vera is very,
well, we've
very
got our first call actually come through. So, assalamu alaikum, hello, and what would you like to ask Dr. Adwan?
Walaikum salam. The question is, what causes acid in the body and how to get rid of acid? And also, some sisters want to consult the doctor. So, what's the best way of contacting him privately in private consultation?
Well, first of all, to be able to contact the doctor, just call through us here, send us an email at the email address we gave you earlier on, and we'll put you straight in contact with the doctor. But let's talk about acid. We always hear about acid being the problem in our stomachs. What do we do to deal with that?
First, you have to be sure, is it high acid or low acid? So a little bit test you can do. Take tablespoon of vinegar and water and see if you have acid or not, or take a lemon juice on empty stomach and see it is high acid or not, because some people confuse between, because nearly the symptoms of high acid exactly the symptoms of low acid. So don't rush and take antacids before you're sure you have high acid.
So actually take some acid in the form of vinegar or lemon, and then you can see whether and if it solves it, you know you've actually got low acid.
Or bicarbonate soda, also take it. If it's bubbling, it means you don't have acid. So try to test yourself before you take. But if you have it, in any case, you can greens. We need the greens. Greens is very high in alkaline things. You know, the animal proteins like meat and chicken and eggs, and they're very acidic. Very good, but very acidic.
So basically, to solve your acid problem, go back to your greens go
things.
back to the alkaline
and that's why
foods.
I said cabbage juice. Cabbage juice is one of the best for acid and for ulcer.
Excellent.
And Helicobacter pylori too.
We want to get through as many calls as we can today, especially as it's our last show. So we've got our next caller on the line. Assalamu alaikum. Hello. What would you like to ask the doctor?
Walaikum salam.
Go ahead.
Hello?
Yep, go ahead. Ask your question.
Yeah. Assalamu alaikum.
Alaikum assalam.
I'd like to speak to the doctor.
Yep, you're through.
Okay. I've had this illness for the last 22 years where I get stomach pains and vomiting, but the hospital don't know what it is. So I spend a lot of time in hospital. Even in the last 2 weeks, I've stayed 6 nights in hospital. And they put in it as chronic pains. And they keep pumping me with morphine, cyclozine, buscopan, and paracetamol, regular. And I'm on fentanyl patches, morphine patches, I stick them on my hands, and all this heavy medication. But it's exactly what the doctor was saying. That's the sort of pains I get: bloating, severe pains, and vomiting and diarrhea.
So are you basically, do you know what the problem is? Has the doctor actually diagnosed it, or are they still trying to work it out?
For the last 22 years, I see the Bart's pain team, and they just keep repeating the same thing and just increasing the doses of the morphine and everything.
So basically, Doctor, if we have a look at this situation for this particular gentleman, obviously, you know, still refer to your doctors, and obviously your doctors will give you the best advice of what they want you to do. And I presume, actually, if he just tries some of the foods that you're talking about, that obviously isn't going to contradict anything that the doctor's doing, but actually might help.
Is this what regarding the pain?
Yeah, but if it's any pain in his stomach that he has, although obviously we're not going to, from the information we've got, be able to tell exactly what the problem is, but anything that you have suggested can only help.
He can start, if he's not diabetic, with honey, local honey. I prefer local honey. He can start with ginger and turmeric. He can juice it and drink it. You can add on both to any green thing, kale, mustard green, spinach, carrot on it, cabbage juice, one of the good best thing, my preference for the stomach ulcer and acidity. Licorice is very good. Aloe vera also is very for the mucous membrane.
So perhaps for this particular gentleman, if he continues to do what his doctor advises, but change his diet slightly to incorporate those foods, that might actually relieve the symptoms a bit.
I'm sure we'll do if he do that.
Okay, fantastic. Okay, on to our next caller. Assalamu alaikum. Hello. You're through to the doctor. Go ahead with your question.
Alaikum salam wa rahmatullahi wa barakatuh. Walaikum salam. I have got something, not ulcer, but acid reflux. But it's so bad now. I've been having it for nearly 30 years, but didn't realize till 2010 that it was acid reflux. I always thought I was overeating. I eat a little and I bloat so much, and my throat is gone. Because then, about 6 years ago, I was diagnosed that I've got acid reflux, and it is my throat is. I was told that I've broken my vocal cord, but actually the acid is coating it, apparently. And they did an endoscopy and then found that I've got the acid right up to my throat. And I'm on medication only the last 6 years, and it has not moved. I was asked what to eat and what not to eat. I followed for 6 months. There's no cure. So now I eat what I think is right, and if it's bad, I just leave it. But often what I eat is not right, and I bloat, and it comes right up to my ribs. And I feel, I don't know whether I'm getting a heart attack or whether it's actually acid. I don't know. It's so bad. So
okay,
I take something called ajwain seed, and that breaks the bloating.
Okay, so let's look at that. Again, you've had some great advice from the doctor about foods that are normally associated with being beneficial for this particular problem. But perhaps you could tell us a little bit about, for many callers, they won't know the difference between acid reflux, peptic ulcers, and the different conditions. So perhaps you could define that for us.
Acid reflux, it happens. That's why you remember when I come to the breaking fast, take 1 date, 2 glasses of water, soup, and then you start to chew. Because when we chew, we give a chance for the stomach to secrete its enzyme, pepsin and hydrochloric acid. The problem with us is some of us, we start to gallop, to swallow. When you swallow, the stomach is not ready to prepare its digestive enzymes. We start to eat quickly. When we eat quickly, the pressure and the size increasing in the stomach between the mouth and the esophagus and the stomach. Between the esophagus and the stomach, there is a sort of muscle working like a valve, open in one way, from the esophagus to the stomach. When we stop eating, this valve closes, so the food doesn't usually go up. When we eat it quickly, we're not chewing some of the food, because the size and the pressure in the stomach start to increase. Part of the food goes up, open the damage that muscle between the stomach and the esophagus, and with this food goes some acid, and this is called acid reflux of heartburn. So my advice is, first of all, to chew. Eat slowly, and start with your food with water. And you can have with that salads, because we need that green thing because salad is top alkaline. If there is acid, to balance this acid. So start with acid. But in addition to that, you can have cabbage juice with carrot of it. You can add on it ginger, you can add turmeric. This is strong anti-inflammatory, strong antibiotic, and help the mucous membrane at the same time. Licorice is very good for mucous membrane too.
Okay, well, we've got, actually just got I see we've got an email that's come in from Pfizer in London. She's asking about general foods, and she's been watching the whole series and asking about the foods that we've been talking about throughout the series. Are there any disadvantages of any of the foods you've been mentioning, like all of these alkaline foods? Is there anybody who maybe shouldn't be having all of these foods? Because they seem to be fairly universal from what you've said in terms of their benefits, but are there any groups of people where it might not be beneficial?
For people who have the problem, when some people, when I prescribe cabbage juice for them, they start to have bloat or gases, or they can't accommodate it. That's why no need for that if you don't go with it. You can use honey instead of it. You can use licorice. Aloe vera is very, very good. But most important, salads. We need the green salad. We need a lot of green.
And could you do you need, if you're changing your lifestyle, say, for example, you're someone who doesn't maybe have a particularly healthy lifestyle, and you're suddenly, hopefully grasping from this show, actually start eating some of these foods you've been talking about, do those people need to very gently adjust their diet? Or could it be a bit of a shock to the system if they suddenly went dramatically healthy, or would that be fine?
This will be a good shock rather than any bad thing, because eating salad is all the benefit. There's no side effect of it. Eating fresh fruit is very good. You can juice the fruit, like banana is one of the best for the stomach, for the ulcer, for the acidity. So eating fresh fruit, juice it yourself and do it. The problem is when you buy the juice from outside, is you can't guarantee is as good as when you juice it yourself. So juice fruit salad if you want, in addition to the natural salad.
I've just seen another question come in, actually from another Ibrahim in London here, and he's saying that with Eid approaching, do you have any tips on how to adapt your healthy lifestyle during the Eid celebrations?
Now, during Ramadan, we're fasting for about 19 hours, and it's a long month. And some people, when it comes to the Eid, they start to gulp, to swallow. So our Prophet ﷺ said, before you go to pray, take 2 or 3 dates with a glass of water and go pray, come back, put your breakfast, and my advice, the first breakfast, to be as light as much as you can. Porridge oat is good. Put your own seasonal fruit. Put your own milk. Put your own the nuts you like. This is full meal. They give you omega. They give you good fat. They give you protein. They give you the fiber. Is very few. So start to ease in the beginning. Not to eat like some people eat meat in the morning. Which is difficult, especially after a long time, 1 month fasting, 19 hours a day. So start to ease, especially in the breakfast. Come to the lunch, also start to ease. Chew. Most important, so chew. When you chew, you're not eating too much. Drink a lot of water between the meals.
Let's talk about general eating habits, because as you say, people have been fasting now throughout Ramadan, which you actually advocate as, apart from people's faith, it's actually a really good, healthy thing to do.
Fasting good, yeah.
Some of the habits that people have created during Ramadan, very quickly, because we've just got another call coming in, maybe just give us a couple of things that hopefully people have done during Ramadan that they could actually continue as a good habit.
You have the good wish and will in Ramadan. You have the will. You're controlling your body. You're controlling your habits. So keep it after Ramadan. This is the lesson we learn from Ramadan, to keep it with us for life after that.
Yeah.
Yeah. So if you have the will and the wish that you did it 19 hours during the day, so you can control your food after that and change your life to the good things.
Fantastic. Well, we've got our final caller through. So, assalamu alaikum, hello. And what would you like to ask the doctor?
Hello, wa alaikum salam.
Hello, go ahead.
Yeah. Hello, how are you?
Alhamdulillah.
I want to ask the doctor about consumption of honey. I want to ask him about consumption of honey.
And what would you like to know about the honey?
I have a lot of honey, and I take a lot of honey. Is it good for me, or would it cause? natural honey. We have a lot of honey where I am. I'm calling you from Nigeria, from Abuja in Nigeria.
Well, lovely to have you on the show. Thanks for calling in. The gentleman was talking there about honey. He has a lot of local honey. I guess really what he's saying is he's eating a lot of it. Can you actually overdo the honey?
No, because honey is sugar at the end. Dates is sugar, honey is sugar. So, and the point about honey, if you eat honey alone, is medicine. If you eat it with food give you energy. So it depends which way you like it. I treat people, I prescribe people with gastritis and ulcer. So if you want to use it as a medicine, take it to 1 teaspoon in the morning or between meals with some water. This is medicine. So if you eat it with food, I eat it sometimes with wholemeal bread, honey and cashew butter and things, and eat with the green tea. So it depends, but too much, no. It's still 85% is sugar in it. So my advice not to. No.
Not too much.
Not too much. No. But honey is in our Quran, holy book. It's very good. فيه شفاء, cure for all disease, as the Quran say. So it's good if you use it in reasonable amount. Yeah.
Okay, we actually are going to cram in just one more call. So good afternoon. Assalamu alaikum. Hello. What would you like to ask the doctor?
Wa alaikum assalam wa rahmatullahi wa barakatuh. I just wanted to ask, I have just tuned in. I didn't really catch everything that you guys said. And I have high SRE. Every time my doctor checks, I have high inflammatory. They don't know why and what's the cause. So I would like to ask him if he can kindly repeat what he was saying, what is good for inflammatory.
So our caller is saying she has inflammatory concerns and
inflammatory bowel disease or inflammatory?
Yeah, perhaps you could clarify where's this inflammation that you were talking about? Is this within your stomach?
Stomach, yes. Yeah. I produce a lot of acid as well, like stomach acid.
Okay, well, one of the things we did talk about earlier on was the doctor mentioned is make sure it is actually too much acid versus too little. You can do a simple test with that. But if our caller is, it really is actually too much acid.
Inflammation means gastritis, she means. This is anything TIS in gastritis, this is inflammation. Inflammation, 3 things: redness, pain, swelling. So the best thing for inflammation, turmeric, ginger, and cabbage juice. Add the ginger and turmeric to the cabbage, juice it and drink it before you start your meal. This is one of the best for anti-inflammatory food for the acid or acid reflux.
Fantastic. Some really good, quick, solid advice there. Let's conclude now with Eid coming up. And as we've touched on already, some people might just be so, excited with Eid and potentially overdo it a little bit, having done so well during Ramadan. What would your advice be in terms of maybe 3 golden rules during Eid so they don't do too much damage after the good work they've done during Ramadan?
The first one, take that goodwill and wish you did it in Ramadan. That goodwill, you have it, keep it with you. So don't spoil it by coming and overeat on first day of Eid. So try to, as the Sunnah, Prophet ﷺ said, few dates, water, and go pray and come back and ease. Eat slowly, chew as much as you can because your body now is clean, is healthy. So give it a chance for your body to be clean, to be healthy, to be strong the days after that. So start with, as I said, my favorite is porridge oat, but if you like eggs, good, but try to chew as much as you can. Take it easy. Drink as much as you can water in between. Salat, very important. Fresh fruit is very important. So take it from there, and I hope to continue that.
And again, I think one of the big things I've learned from you during this entire season is about water and consumption of water being a really vital part of a healthy lifestyle.
Yeah, the thing, the water is, even Quran say, وَجَعَلْنَا created everything life from water. The Quran said, and without water we can't live. We mentioned water in 4 elements of the food. Water is one of the 4 elements: carbohydrate, fat, and protein, and water. Water is helping balancing increasing our temperature in the body, taking the waste out, bringing the nutrients in, helping utilizing the water-soluble vitamin C, family of vitamin B, is necessary for every operation, digestion, absorption, excretion of the waste. So, and don't wait until you are thirsty, because when you are thirsty, you're going to be dry. Sipping all the time. That's why I keep water in my desk, in my office, in my sink at the bathroom, in front of the television. I keep sipping all the time to keep my body hydrated.
So apart from water, which I think is probably your top tip that you feel very strongly about, just to conclude, all of the things we've been talking about throughout this entire series, we've had some fantastic conversations and great questions from our audience at home. What would be, after Eid is finished and people get back to normality, what would be your 3 golden rules of a healthy lifestyle and healthy eating?
When you eat, chew. Start to chew as much as you can. Put the salad, the main dish of, the salad is the main dish of your meal, and then you can put the side one, whether your meat or your chicken or whatever you prefer to put in there. Try not to mix if you want to be healthy and to be fit. Try not to mix if you want to lose weight. As I said, salad, piece of chicken, salad, meat, salad, those ones. But there's no place for the starch here.
OK, well, thanks so much. I mean, it's been absolutely fascinating finding out so much more. Hopefully, we'll all actually take on your advice. And some really important and useful advice there about peptic ulcers and general healthy eating as well. And we hope that the alternative medicine information has helped you if you're suffering with a peptic ulcer. And remember, of course, that we do stress, as always, the views and opinions on this show are strictly those of Dr. Adwan and are based on an alternative solution to illnesses. And should you suffer from any type of illness, it's always recommended you go and see your GP or medical consultant first. That's all we have time for today, and indeed for the entire series. A big, big thank you to Dr. Adwan for providing us with some great advice throughout Ramadan. And thank you at home for tuning in to the Health Show Ramadan special and for all of your questions throughout the season as well. If you'd like to find out any more about peptic ulcers, or for that matter, any of the other topics we've covered in the series, then please do email us at healthshow@islamchannel.tv. And we hope that the information over the course of the past few weeks has helped you in some way to better your health. All it leaves us to say is have a wonderful Eid Mubarak and Assalamu alaikum. Goodbye.